You feel it in your buttocks. Maybe it shoots down your leg. Maybe it's your hip. Maybe it's worse when you walk or when you sit or when you get out of bed. And you've probably already Googled it. So you've already been told it's sciatica or a disc, or maybe your doctor said it's just arthritis. But here's the problem with that. The exact same pain, buttocks, hip, down the leg, can come from several completely different places. And they get mixed up constantly. Even the word sciatica gets used as a catch for all things that aren't sciatica at all. So if you're sitting there wondering what is actually causing your leg and buttocks pain and why nothing you've tried has worked, that's exactly what we're going to map out today. I'm going to walk you through the most common sources of this kind of pain. And more importantly, the clues that point towards one versus another, where it hurts, what makes it worse, what makes it better. And near the end, I'll give you the single most useful question you can ask yourself before your next appointment, the one that helps your doctor more than any symptom you could describe. I'll also cover the warning signs that mean you shouldn't wait at all. Stick around for both. I'm Omar Ramos, a fellowship-trained spine surgeon, which means a big part of my job, honestly the hardest part, is not the operation. It's sitting across from someone who's been told three different things by three different people and then trying to figure out where the pain is actually coming from. Because if you get that wrong, every treatment after it is aimed at the wrong target. Here's the root of that confusion. Your lower back, your pelvis, your hip joint, and the nerves running down your leg are all packed into the same small neighborhood. They share space, they share nerve pathways. So when something goes wrong in one of them, the pain doesn't always stay where the problem is. It can get felt somewhere else. We call that referred pain. That's why someone with a hip problem can swear it's their back, and someone with a back problem can be convinced it's their hip. The body is generally bad at telling you where the signal started. So let's go through the suspects one at a time. Suspect number one, and the most famous, is a pinched nerve in the lower back. That is what true sciatica actually is, a nerve getting compressed where it exits your spine, often from a disc. The classic clue, the pain travels. It follows a line, buttock, down the back of the thigh, past the knee, sometimes into the foot. Pain that goes below the knee and comes with numbness, tingling, or that electric shooting quality, that pattern points towards a nerve root. When someone tells me this in clinic, the first thing I want to know are how far down the leg it goes, and is there any numbness or weakness with it? Those two answers, how far it travels and whether the nerve is just irritated or actually weakening a muscle, change everything about how seriously we take it. But, and this matters, not everyone with a pinched nerve gets the textbook version. Some people just get the buttocks pain, which is exactly why the next suspect gets confused with this one constantly. Behind your hip joint, deep in the buttocks, there's a small muscle called the piriformis. The sciatic nerve runs right underneath it. So when that muscle gets tight or irritated, it can squeeze the nerve and create pain that feels exactly like sciatica. The difference? With piriformis-related pain, the trouble usually starts in the buttock itself, not the back. Sitting often makes it worse. It's also what we call a diagnosis of exclusion, meaning we mostly land on it after ruling other causes out, not by finding it directly. Here's one of the most useful tricks in the whole video, and it's about telling hip pain from spine pain. I call it the pants pocket rule. If your pain sits in the front, around your groin, the front of your hip, where your front pocket is, that point towards the hip joint itself. If it's in the back, the buttock, the back pocket area, that points more towards the spine. In clinic, the question I lean on here is simple. Does it hurt to put on your shoes and socks or to get out of a low car seat? Hip joint pain tends to flare with exactly those movements, rotating and loading that hip joint. But here's where I have to be honest with you, and I'm going to keep saying this throughout the whole series. The pants pocket rule is a clue, not a verdict. Plenty of people break it. There's even a situation we call hip spine syndrome where the hip and the spine are both involved at the same time, and the rules blur completely. A rule like this helps you ask a better question. It doesn't replace an exam. There is also the sacroiliac joint. Where your spine meets your pelvis, there's a joint on each side, the SI joint or sacroiliac joint. When it's a source, the pain usually sits low, off to one side, right around that dimple above your buttock. People often point to one specific spot with one finger. That pattern makes me think about the SI joint. It can refer down to the buttock and the back of the thigh, but it usually stops above the knee. And that's part of what separates it from a true pinched nerve. Still, it's one of the most mislabeled sources there is, in both directions. Called sciatica when it's not, and missed when it actually is the problem. Now, here's one that gets me, especially in patients over 60 years of age. If your leg pain shows up when you walk, your legs get heavy, achy, crampy after a block or two, and it eases when you sit or lean forward on a cart, that's a specific pattern. When it comes from narrowing in the spine, we call it neurogenic claudication. But there's a lookalike. The same walking pain can come from poor circulation in your legs, blocked arteries in the legs. That's vascular claudication. The clue that helps separate them is that the spine version is posture sensitive, meaning when you lean forward on a shopping cart, on a counter, it tends to relieve it. The circulation version doesn't care about your posture. It eases when you simply stop moving and using those muscles. And if it turns out to be the circulation type, that's worth getting checked promptly because blocked arteries in the legs can be a warning sign for the same problem in the heart or other areas. And then there are the ones outside the spine entirely. Things like peripheral neuropathy, where burning or tingling in both feet is often worse at night and it isn't really tied to walking distance. I'm grouping these quickly, but they round out why leg pain is hard to right away attribute to one thing only. Now, before the helpful question, the part you actually need most. Most leg and buttock pain is not an emergency, but there's a few warning signs that if you have them, means that you shouldn't wait for an evaluation. New or worsening weakness in your legs, your foot is dragging, you're catching your toes on the floor, or the legs are buckling under you. Also, new numbness in your groin particularly or your inner thighs, or new loss of bowel or bladder control. Back or leg pain that comes with a fever or with unexplained weight loss. If any of those things are happening, this isn't a wash and wait situation. You need to get evaluated soon. Okay, the thing that I promised at the start. The single most useful question to answer before your next appointment is not where does it hurt, is this. What makes it better and what makes it worse? Does sitting help or hurt? Does walking help or hurt? Does leaning forward change anything or it doesn't? Does it travel below your knee or it stays put right around the buttocks? Those answers, better and worse, how far it travels, can tell a trained examiner way more than almost anything else. Write them down before you go in. Because here's the truth underneath this entire video. Every clue I gave you today, the pants pocket, the below the knee rule, the walking pattern, every one of them is a probability, not a proof. A real diagnosis isn't just one clue, it's history plus examination plus imaging, all of them put together by someone trained to weigh them against each other. And even then, what we land on is a differential. That word matters. It means our best supported explanation ranked against the alternatives. It means we stay open to being wrong and we adjust when your body tells us something new. So if you take one thing from this, these conditions can overlap, they can coexist, and they can hide behind each other. The clues help you ask sharper questions. They don't let you or me from a video diagnose you. That's what an in-person evaluation is for, putting your images, your exam, and your story into context. If this map helped, the rest of this series breaks down each of these one-on-one. The next one is hip versus back, where that pants pocket rule gets a full breakdown. I'd start there. And if you want the version of this that explains why walking specifically triggers leg pain, I've got a full video on spinal stenosis linked up too. I'm Omar Ramos, a spine surgeon at Twin City Spine Center in Minneapolis, Minnesota. I'll see you on the next one.